So the Royal College examinations essentially are the FRC OFT, which is now available in this country, and the FRCS Glasgow and the FRCS Edinburgh. And the advantage of FRC OFT London is that it allows you to mainstream into the UK training program. The UK training program is a 7 years program, and the FRC OFT has been specifically designed with that specialist training program in the UK. And you are supposed to go through the different stages of the examination according to the number of years that you've spent in the training program. So you have in the FRC OFT, you have the first of all a part 1 examination, which is a MCQ examination in 2 parts of 90 questions, MCQs each, which is supposed to be given after about 2 years of your training in the residency program. And that is supposed to cover the diagnostic investigation techniques and the clinical part as well. So you're not supposed to be good enough to do it before 2 years. By the end of 2 years, you should approximately do that program, and you progress further into the 3rd year after. The FRC OFT examination, now available in India, offers the advantage of if you complete FRC OFT, you don't just have a PLAB exemption, you have the possibility of getting FRC OFT, which integrates into the UK training program. So after you cleared your part 1, you have the option of appearing either in the refraction certificate examination or the part 2. Not this talk. Okay. So, yeah. Thank you. Great. So the reasons why people take these exams, either FRC OFT or your ICO exam or FICO, one of the reasons is you want an international validation by an exam which will be accepted when you travel beyond your borders, and if you particularly specifically for these FRC OFT or FRC S exams, if you want to train in the UK. Now, the Glasgow and Edinburgh exam only give you a GMC exemption when you complete an FRCS, but no entry to specialist training, and as we already said, the FRC OFT does. The main objective of these examinations is to find out if the person who's appearing in the exam is able to work independently in a safe and professional manner. So this is the crux of what they want, that this is a safe practitioner. Every single time, that is what is stressed. So they look specifically for those things which can make you an unsafe practitioner. So we have already spoken about ophthalmic specialist training in UK, which is a 7 years of PG training leading to a certificate of complete training and culminates in the fellowship of the college. Now, part 1, as we said, is to be completed by year 2, which is 90 questions, 2 papers on basic aspects, including clinical sciences, basic sciences. Refraction certificate is totally a clinical exam, 9 different stations, subjective and objective refraction. They would like you to do retinoscopy on models now or on patients when the full exam is possible, non-COVID times. And part 2 is written and part 2 is orals. These 2 are to be completed before you complete your 7 years in training. Part 2 written is 180 MCQs with your full, these are essentially exit exams which kind of certify that you have now done enough to qualify for a safe practice in the UK or elsewhere in the world. So part 2 orals is constituted by Viva and an clinical OSCE, clinical cases based OSCE. For overseas candidates, there are no eligibility restrictions, but these exams are recommended at least after 4 years in clinical training. So orals again are structured with these 5 stations and a 6th station totally on communication skills. And 1 station is attitudes, ethics, and responsibilities. 1 station is audit, research and evidence-based practice, health promotion and disease prevention, besides patient investigations and patient management. So there is a lot of emphasis on professionalism, as Srinivas said. Now in the part 2, you have the division into different subspecialties based on real patients and videos taken as short cases, but everything done in a very objective manner. All responses are predetermined, and the same questions, same set of questions are asked of all the examinees, making sure that they're not mixing with each other. We've already spoken about the order of examination. Part 1, then either refraction certificate or the part 2 written, whatever you want to. But you should have passed all these 3 before you appear in FRC of the oral examination. So now the oral examination is available in several other countries: India, Trinidad, Tobago, Egypt, Singapore, and Malaysia. We organized the first exam at Vision Eye Center in February. The second one will be at Shankar Nethralaya, and third one will be at Arvind Eye Hospital. Every 6 months they'll be holding one, so that each center will alternate with either refraction certificate or with the oral examination. The FRCS Glasgow is, again, the format is somewhat similar but somewhat different again. 3 parts. Each part must be passed before proceeding to the next one. And in future, all written examinations of FRCS also, like FRC OFT, will be available online. So now you can appear in all these exams and anywhere in the world if you have a center where the practical part is held. So part 1 was basic sciences, again MCQs. Part 2 was earlier 2 parts. One was problem solving paper and second was MCQ. With effect from October 21, it will be only an MCQ of 180 questions. So that part about problem solving is gone from Glasgow. And now they also have made an MRCS Ophthalmology Glasgow with effect from June 2021. And part 3 is after you've completed the other 2. It has a structured oral or viva component and a clinical examination component. 3 20-minute vivas of different parts. The important thing is that the structure is that it's quite an objective one. You again have defined questions, defined answers to be sought from the candidates. 2 examiners sit together, mark independently. While one is asking for the first 10 minutes, the other one is only observing and noting down the points about the responses. And after 10 minutes, it will shift to the other examiner asking, and the other one only listening. And both mark independently. And whenever you give a fail mark, you have to give a justification, the reasons for it. And very often, your marks are quite similar based on all the guidelines that they give you. There are plenty of guidelines. I'm probably one of those who's done the maximum number, probably 31 exams of FRCS Glasgow now. So doesn't make you any better, but that's the thing. Okay, then part 3 also has the clinical examination, which is an examination where you are speaking as you examine. There are again 2 examiners, and they'll be again asking for 6 minutes each if this is a 12-minute thing, and you may cover 2 or 3 or 4 cases in the meanwhile, depending on how well you answer, and you will be marked based on that. Edinburgh examination, there was a partnership with ICO earlier for the MCQ part, which has now broken down after all those revolutionary changes that have taken place in ICO with splitting of the education fellowship and all that. So now there is going to be a new MRCS Ophthalmology online examination by the college this year. Details are awaited. Claire, who was earlier organizing the ICO exams as the head, is now advising them and doing it for them. So the part C is the one which is the final one, where there is a written paper of MCQs and structured orals and structured clinical OSCE again. The ICO exams, we all, is the most popular exam. We are the country with the second largest number of candidates in the world after Egypt. And started in 1995, only worldwide specialty exam being held in any specialty. And the again, it's a confirmation of your ability, and you get exemption for some of the exams, FRCS, etc., if you've done certain parts. And this has a basic science examination, which covers visual sciences and optics, and a clinical science examination, part C, and an advanced examination. This was also 115 questions or 180 questions, depending on whether you wanted to apply for FRC Edinburgh. So that's why they had to make 115 questions and 180 questions. So these are the essential exams. There was a subspecialty examination which I had forced upon them when I was subspecialty committee head. It was not making money, so the new revolutionary ICO has removed that exam from, because they are more concerned with whether we make money per exam or not. So visual sciences examination covers all the basic sciences, and the advanced examination entitles you to the acronym or degree or FAICO. So the eligibility is defined in ICO examinations, and FICO acronym is then given. But besides passing examination of the advanced examination, should have a recognized local face-to-face. Another 2 minutes? Yeah. Okay. So FICO examination is the one that I am in charge of as the president of Collegium at present, and I can say with surety that I read a few blogs, and I totally agree with students that it's not a standardized exam, it's not a very well-structured examination. So we are doing something about that. The subspecialties that are covered are known to you. 8 subspecialties with cornea, contact lens, external disease, with refractive surgery being the 9th option. So these are the new subjects. We have changed it from this year. These will be the subjects now. And we made all of them, including comprehensive ophthalmology, as 1.5 years now. We have prepared guidelines, which we prepared 5 years ago. We have revised them so that we hope. It was done with as a consensus document involving all the major institutions of the country, and we hoped to start the accreditation, which we now hope to do once we have these revised guidelines, a 350-page document compromised by this group and now comprehensively revised, being released here. And we hope to start accreditation of subspecialty program with all the guidelines that have been prepared to standardize fellowship training at the postdoctoral level throughout the country to help achieve standardization, which Srinivas was talking about, in subspecialty training, as well as to create subspecialties with appropriate expertise. So we have defined the content of curriculum, and we have defined the guidelines for the entire programs. And for the FICO examination, we have the MCQ and the clinical examination component. AIOS, as you know, has been a pioneer in subspecialty examinations. We were the ones who started it first with the online exam, and then we gave it to ICO, and other countries also, some of them started after that. But the FICO multiple choice questions needed a lot of change. So what we have done is we have involved the erstwhile ICO examination team. That team came out, led by Nicola Quilter and her education experts and her subject experts. So we have engaged them on behalf of AIOS. We have already signed a memorandum of understanding with them on behalf of the Collegium. So we'll now make sure all the process of standardization, validation, standard setting for results, and including ensuring that each question is linked to a certain part of the curriculum, which we will now put on the website of FICO, which now includes the suggested reading material, suggested minimum procedures that fellow should do. It includes the minimum facilities that should exist in an institution which does it, and the time sequence, the facilities for fellows, the facilities for faculty, and everything has been defined. So we hope that this exam will become a gold standard for subspecialty examination worldwide. And we will also totally review the clinical examination to make it more relevant and more appropriate and standardized. Let's hope it works out well. Thank you very much. Sorry for taking the extra.
Thank you, sir, for a great overview of all the options available. One quick question. How one can decide one examination over the other? How one could decide?
It'll essentially depend on one's choice and what you are interested in. If you are going to settle abroad, probably you would want to do an FRCS or an FRC OFT. If your choice is UK, FRC OFT, certainly. If your choice is Singapore or getting additional remuneration if you go to Middle East, then FRCS is quite good.
For staying in India?
For staying in India, it just adds that confidence to you that you have an international something, otherwise nothing else.
Okay, sir, thank you so much. We have our next speaker, Dr. Praveen Krishna, who will be presenting on making an effective presentation and enhancing their podium presence. So before he starts up, Ashok sir, Grover sir, I just want to have one question with the panelists as well. So when you are taking your fellows and you get to know that they are appearing for FRC opt, MRC opt, how much percentage of it matters while selecting the criteria for the fellowship? Dr. Avinash?
In terms of selection of fellowship?
For the selection of the fellowship, you get to know that the person has passed FRCS Part 2. Now he is applying for Part 3, or he is doing MRC opt. He has passed it recently.
Yes.
How much of that will actually matters? Because in India, as Grover sir said, it adds up to the CV. But in Western world, that's the licensing exams. So in India, since it's not the licensing exam and it's more of an added degree and it brushes you or makes you a more perfect person. So how will you consider it while doing an institution?
Who says it's going to make a perfect person?
Not a perfect, but at least it adds up to your CV. That's what Dr. Grover said.
It's another decorated certificate on the wall. It's all about, a degree is if it's not attached to a purpose, right? I'm being a little bit honest about it. So if for an individual, if you have to practice, the competence is what is required. Skill set comes next. And these certifications are, as the first block or the first step towards it. But at the end, you can have a fantastic certificate hung on your wall, and if you're not competent in skill, everything falls flat, right? So, but answering to your question, would it be an important factor for someone to be selected for a fellowship program? May or may not.
One thing which happened during my thing is, patient came to my place and there was just a glass perfusion. She insisted on seeing the chief sitting outside on the other hall. I said, what, you just need a glass and go? No, I want to see specialists. There, see, it is written there, FRCS glass. So I want to go there, FRCS glass. So may add value like that also in India,
True. Yes, quickly from PGI and Girish.
No, it doesn't really make a difference to our selection of the candidate, whether...
So I wish we had a say in the selection of candidates. A lot of them would not make it. But yeah, having said that, if somebody has it, it would probably, in my mind, to be honest, give some level of standardization to that person more than pata nahi kya hoga MS mein. So that's all. Yeah. But ultimately, talking to them and giving them in would be.
Yeah.
So
because there have been situations where we have taken a DO candidate over an MS.
Correct. That is